Dental crowding and actually changes to the facial form, like longer faces and weaker chins and smiles that really aren't looking right, even from an early age, from 5, 6 years old on. One of the most common reasons is a change in our function. And our form, our facial structure, follows our function. So if that's not proper, we'll see all kinds of changes that are unwanted, but also unhealthy. One of our aims here at Myofunctional Therapy is to address those functional changes that are changing our facial form and our dental crowding so we can get a child back on track. My name is Jordan Kane Smith. I am the dentist here and owner of Breathe Modern Dentistry. Myofunctional therapy, the best way I can explain that is it's therapy that is designed to address disorders of our myofunctional patterns. That's going to be referring to the way that we chew, swallow, and breathe. And our goal is to address any change in function that's occurring with those patterns that will have vast changes to our development, our quality of life, and our overall health. So treating someone with myofunctional disorders is going to start with a very thorough analysis of what functions are actually changed or what's not completely normal. After we know what challenges we have in front of us, we design a very customized plan so that we can treat a patient's disorders and get them to function back on track. So myofunctional therapy, the best way I often explain it to parents and kiddos is it's really the diet and exercise conversation that circles around weight loss, for instance. When we have changes to our bite, our smile, our sleeping patterns, you name it, and we're trying to understand what treatments might be available, we need to go back. We need to look at actually what's causing these problems to occur or worsen, and we actually go to treat that. So myofunctional therapy, the aim is really to get back to the basics of what caused the problem, to address that. So any kind of solution that we throw at these things, like braces, and you name it, will actually stand the test of time so that we're not just unraveling because the problem was never truly addressed that started it in the first place. So myofunctional therapy is really something that we can do for anybody at any age. But most importantly, if someone is doing this at a very young age, say maybe between the ages of 5 and 9, we tell parents all the time, our goal is to help your child breathe better, sleep better, avoid things like braces and dental crowding by helping the body return back to a natural form the way it was intended to grow, instead of skewing off path because of the things that we're doing in our daily lives that most of us think are innocent. They're having a vast change to our overall health and appearance. If you or your child, for instance, is having concerns, you're seeing changes in sleeping patterns or the smile, relapse, or just the generation of change that we don't want to see in your child, myofunctional therapy would be something to truly look into. And if you'd like to give us a call, reach out to us in any way, shape, or form. What we're going to do is try to get you a consultation set up to understand and address the concerns that you guys are having, formulate a custom plan so we can get you back on track and get the body to do what it was always intended to do in the first place.